We are almost, short of time now, so probably we'll just open it up for QA, take some patient questions. I know you have some more questions for Dr. Shore and Dr. Moorcraft, but based on time, I think we should take some patient questions right now. I will just open up for QA. If you have a question for the panel, please dial in using 718-664-6574, and you can press 1 on your phone keypads, and we will bring you on air to ask your questions. I want the expert panel to know that we have received more than 50 questions, and audience, it's mostly impossible to cover all the questions here. But what we'll do is we will try to pick up the common topics that have come up in the questions and get the panel to answer some of them quickly. We just need, doctors, we need very brief answers for this so that we can touch upon most of the topics that have been mentioned in the questions. So, Dr. Liegner, there's a question. Can Lyme disease cause dental problems?
I'm sorry, what?
Can Lyme disease cause dental problems?
That is a really good question, and I'm not sure I'm that well equipped to answer it. Certainly it can affect the nerves that subserve the face and the teeth, and I have heard of patients complaining of dental issues that were attributed to Lyme. I don't think I can really answer that question from my own experience very well. So I'm sorry.
That's okay. Dr. Moorcraft, we have received a lot of questions on alternative and natural therapies for Lyme disease. Could you please educate us regarding available holistic and natural treatments?
Yeah, sure. I mean, I think a lot of us know that, a lot of our medications actually come from either, fungi or different herbals originally, and then we sort of synthesize them in a lab. And so if we look back at sort of cultures throughout the ages, they've been using herbals that have anti-infective, antimicrobial properties, very successfully for a long period of time. And to kind of just quickly run through some of the things is, from an anti-infective perspective, we have the ability to use herbals in both teas and tinctures. They also come in capsule forms. And so there's tons of different things out there that a well-trained practitioner can help you with. Other parts that come along with all sort of the alternative and natural therapies tends to be a real focus on the immune system and regulating naturally the immune system. We know that approximately 70% of our immune cells live in the gut wall. So focusing on the microbiome, all the good and bad bacteria in the gut, as well as the fungus that are normally in our gut, is very helpful. We often can do this through dietary modifications and sometimes, gentle dietary cleanses, and certainly there's all kinds of other things that can be done there. When we're looking at alternative and natural therapies, lots of people focus on different ways to naturally support detoxification, which can be anything from, homeopathics to different nutritionals, depending upon if somebody may be deficient or not, antioxidants, such as glutathione, or some of the precursors to glutathione can potentially be very beneficial. Some of the old school treatments, like using, Alka-Seltzer or, another antacid to help lower, to increase the pH and lower the acidity of the gut. Epsom salts baths sometimes are used. And then simple things like I sort of mentioned earlier, movement and taking advantage of the body's natural abilities, such as having a regular bowel movement and drinking, good pure water, often will fall into that. And I think that's probably a quick summary of things that are out there. And, if we had more time, we could dive much deeper.
Thank you, Dr. Moorcraft. Dr. Shore, what are your thoughts on the possibility of eradicating viruses that interfere with Lyme disease treatments through supportive oligonucleotide technique?
Well, it's my perspective that viruses very often are dormant until there's an immune stressor. and the infection, Lyme disease, Borrelia burgdorferi infection, it creates that stressor, so that there are many viruses, including Epstein-Barr EBV, which is classically thought of for mono, and other herpes viruses that become active when Lyme becomes active. And what I've found generally in the majority of cases when I think that there may be viral involvement, that treating the underlying bacterial infectious process and in so doing allowing the immune system to become more healthy very often takes care of the viral load so that we don't need to use antivirals. That being said, there are some people who have recurrent zoster or other cases, HHV6, human herpes virus 6, which independently can cause fatigue and other systemic symptoms. Sometimes people will need antivirals for those infections.
Thank you. Dr. Shea, I know you spoke about neurological Lyme, but there's a question from a parent who asks, it has affected my daughter's ability to learn, organize her thoughts, and process information. What can we do to help her?
Well, the first thing is we have to understand what are the components that she's talking about. And the only way that can be done is through a neuropsychological evaluation, which will look at the panoply of cognitive issues such as attention, concentration, the various types of memory, executive functions, multitasking. All of those things have to go into the development of a treatment plan. So in order for anyone to develop a treatment plan that's effective, they have to first have the neuropsychological evaluation to know what strengths the child has and what weaknesses the child has. The strengths often can be offsetting of the weaknesses if you know how to use them effectively. But certainly one of the things a parent can do is immediately look at the functional life of the child and ask about the consistency of the family pattern. So is a child eating every day at the same time? Are they exercising every day at the same time? Are they going to school every day at the same time? Or are they playing at the same time? Are they going to sleep every night at the same time? There has to be a consistent pattern within the child's functional life. That's the first thing that has to be implemented. The second thing then has to be within that consistent pattern of functionality, what do we then have to do to help the specific child in the areas in which they are failing? And if there's quite a difference between someone failing in history or someone failing in language than someone failing in mathematics. There are very different components of the brain that handle those areas, and so you need to know if those areas are presently in decline, how you can then implement either a psychopharmacological intervention, which might be a psychostimulant, or whether in fact, and that's not my preferred choice, but sometimes that's necessary, or whether you develop a behavioral pattern and a consistent pattern within the family that will support that child. And it takes a lot of work for a parent, one, to do that, two, to understand it, and three, to have the stamina to convince the child that consistency is the best path, because most often children don't like that kind of approach.
Thank you so much. Dr. Liegner, a couple of people have wrote in asking whether Lyme disease patients can donate organs.
That is a great question. And personally, my own personal view is that could well be unwise because there is so much evidence of persistence that can occur that I don't know. I would be very circumspect about organ donation in people who certainly have active Lyme, and then once they've been treated, the question is, have you eradicated the infection despite the treatment? And as we're learning, Dr. Shore mentioned the recent article by Monica Ember's group that just was published in this past December, that despite application of doxycycline at a dose that many people assumed to be curative, the infectious agent is still present. So I don't know if there's an official policy by those agencies that officially do organ donation. The same kind of question comes up with blood donation too. If people who have had Lyme disease and been treated for it, should they donate blood? I know that if a person has ever had babesiosis, I'm pretty sure it's forbidden for them to donate blood, or the blood banks won't accept it. And I'm not sure if there's a blood bank policy about blood donations from people who have had Lyme and been treated. Of course, that could really pose a big problem because so many people have contracted Lyme. You start prohibiting them from donating blood, that you're not going to have many people to donate. I guess it's just a personal opinion. I would be very circumspect about organ donation in people who have had Lyme disease. That's my own opinion.
We have actually already crossed my time. Dr. Legner, it would be great if you could just talk a little bit about ongoing clinical trials that Lyme patients need to keep track of, and then we can wrap up for today.
Golly, at the present time, I am unaware of any formal sponsored clinical trials for the treatment of Lyme disease right now. I think a lot of the so-called trials of treatment that are going on, or trying to expand the approaches to Lyme, are those that are being attempted often in the offices of frontline treating clinicians out of necessity. I think it's been many years since there have been any formal government-sponsored funded trials of different actual treatment methods. Now, there is funded research on in vitro, meaning in the test tube approaches. Now, for many years there was complete denial that there could be such a thing as persistent infection despite application of treatment. In recent years, the evidence has become so overwhelming that it's obvious that it's a problem. And right now there are 3 excellent groups that are attempting to explore novel approaches. So far, that's been mostly in the test tube. There's Ying Zhang's group at Johns Hopkins has been doing excellent work. Kim Lewis at Northeastern University has been doing very interesting work, and also Jay Rajadas at Stanford. So what a lot of them have been doing is taking some of the things they've been doing is taking agents that are existing in the pharmacopoeia, meaning that they're already FDA-approved drugs, and trying agents that nobody would ever think before to use for Lyme disease, and just trying different agents, different combinations of agents, and finding things that are quite surprising, actually have activity. So that's encouraging. And I think we may stumble upon something that really is very, clinically useful. That's on the one hand. On the other hand, others have argued that we really need to not just use agents that already exist, but really with a deeper understanding of the biology of Borrelia and some of these other tick-borne diseases, really try to innovate with new approaches that are not just the common antibiotics or antimicrobials, but new agents that can really intelligently target some really strategic point in the biology of these organisms that can really knock them out and result in a definitive cure. And of course, that's the goal. And the good thing is that type of work is occurring. A lot of that work is being funded by private organizations, including the Global Lyme Alliance has been doing excellent choices on what to fund. So.
Thank you so much. I think there is a need for more programs as this so that we can share and inform all the people who've been listening, Lyme disease patients and caregivers. It is certainly important to spread this information now. The CDC estimates that over 300,000 people in the United States are diagnosed with Lyme disease each year. and it is one of the fastest growing vector-borne infectious diseases in the U.S. and Western Europe as well as other countries. So I think all this information that we have shared today is absolutely invaluable. Thank you so much, Dr. Liegner, Dr. Shea, Dr. Moorcraft, and Dr. Shore. We had some more questions for you. Probably we'll try to get them answered from you for the audience at a later point. Jackie and Jennifer, great questions. Sorry, Jennifer, we could not complete your list of questions. Probably we'll have part 2 for this and get to them. And this talk will be made available on CureTalks.com for replay. Please visit CureTalks.com for details on all our upcoming talks. Thanks a lot. Have a great evening.
Thank you.
Thank you.
Thank you very much.
Thank you.